Hi, folks. My name is Greg Turner, the Radiology Coach. My job is to demystify the enigmatic world of X-rays.
When it comes to X-rays, the pregnant patient will demonstrate high anxiety and fear, particularly when they have been asked this question repeatedly and there are signs posted all around the radiology department. Although it is important to know whether or not a patient is pregnant, these repeated signs of caution can create the wrong message. It may communicate to some that X-rays are incompatible with those carrying a child, or that the radiation will harm or damage their future child. That, in conjunction with false taboos and social mores, has created a heightened sensitivity to the situation. It is indeed responsible for an X-ray department to post caution signs for those who are pregnant. It is also fully appropriate for clinical staff to ask the proper questions. But what must be conveyed to the general public is that deleterious situations caused by X-rays is extremely rare, if not non-existent. It is true that fetuses harbor rapidly dividing cells, which have proven to be more susceptible to X-ray photons. But the amount of exposure required to elicit significant damage to these cells is marginally higher than that used in standard diagnostic X-ray exams. Because X-ray professionals are trained to protect women with child in their womb, examinations are executed with excess lead protection, where the patient has shielding to block the primary beam from the abdomen. Therefore, these patients can have diagnostic X-rays of their head, chest, and extremities in normal fashion. The one thing to consider is that the maximum exposure recommended to these women is 0.5 REMS annually, as compared to 1 REM annually for the general public. This means that pregnant women can have up to 50 chest X-rays in a year without raising flags with experts. Of course, that doesn't condone trying to push this limit, but it does put things into perspective. And no individual, pregnant or not, should have X-rays unless it is necessary. The real question is, can a pregnant woman have X-rays of her abdomen? Is it okay? And the short answer is a resounding yes, if it is necessary. When X-rays of the abdomen are required, low doses are used. If a fetus is directly exposed to X-rays in this manner, studies indicate that there is no significant damage with one or even a few X-rays that are applied directly to the abdomen. The greater risk is imposed when pregnant women refuse treatment because their existing condition itself can potentially cause harm or damage to themselves and their child if it is not addressed. It is also important to understand that the unborn experiences regular risks during a term because of outlying factors that are not frequently addressed. Overexposure to gamma rays from radioactive substances or radon is far more common than medical X-rays. Alcohol consumption, drug addictions, viral bacteria, prescription drugs, microwaves, and traumatic events all impact the survival of the unborn. Compared to these occurrences, X-ray exposure is virtually a non-factor. The theme of this video is to simply advocate that when patients need X-rays, they should get X-rays, and when it is not necessary, they should not. Medical facilities must document when a pregnant individual has received X-ray treatment. This is usually to provide evidence when they are challenged in a court of law. When a fetus has been compromised, it is most often determined that the cause is stochastic, or that there are many factors that could contribute to these episodes, as listed earlier. Women have a 1 to 3% chance that their child will have some form of congenital malformation or malady. It is their responsibility to understand all elements that can cause these problems and either avoid them or minimize their exposure to them, all the while not living in fear of the unknown. X-rays are safe to a point. Experts agree that this point is measurably higher than the general public perceives it to be. Have confidence that your clinical X-ray specialist will protect you during your examination. If they don't offer you a lead apron to start, request one. If you are receiving an abdominal exam, allow them to do it, but feel free to request that they collimate the X-rays to a limited area and that they use as little radiation as possible. Most are already trained to do so. That concludes this segment on pregnancy and X-ray exposure.
If you like this presentation, please select the subscribe button below this video. You can also tap the bell next to it so that we'll notify you when other great videos have posted. My name is Greg Turner, and I'm the Radiology Coach. And remember, mark my word and mark your films.